Good day, sir. Today we will be discussing another topic which is about psychological disorder associated with brain injury. Brain injury can result in a vast array of psychological effects. Common issues include depression, anxiety, anger, cognitive, thinking issues, and problems with regulating behavior. These issues can either develop because of damage to the areas of the brain that are responsible for managing emotions, or as a result of struggling to do the things that you once did. Psychological changes are therefore a very common effect of brain injury, and they can sometimes improve over time. Mental health is a broad term used to describe a wide range of psychological conditions, such as schizophrenia, clinical depression, and anxiety disorder. Each condition has characteristic psychological and emotional and behavioral effects, and it's serious enough to have an impact on everyday functioning. In extreme cases, a person with a mental health condition may have psychosis, in which they experience things that do not actually exist, such as hallucinations and delusions. For instance, schizophrenia is a condition that has distinct symptoms such as hallucination, and these symptoms can have a major impact on day-to-day functioning. Another widely known mental health condition is bipolar disorder, in which people have rapid fluctuations of high and low moods that are not necessarily triggered by external events. It may be that you experience the kind of symptoms that people with a mental health condition experience. However, to be diagnosed with a mental health condition, a person needs to demonstrate some degree of each of the characteristic traits of specific condition as defined by manuals such as the Diagnostic and Statistical Man, Manual of Mental Health Disorders. The DCM-5, for example, although you may show psychological traits of emotional ability, rapidly changing or exaggerated emotions, you will not be diagnosed as having bipolar disorder unless you display other traits required for the diagnosis. Another example is that you may demonstrate behavioral that seems to be obsessive, but this does not mean that you should be diagnosed with obsessive compulsive disorder, or OCD, unless you display the other required traits of OCD, such as engaging in the behavioral on most days for at least 2 weeks. An appropriate professional, such as a clinical psychologist, neuropsychologist, or neuropsychiatrist, will be able to decide whether or not the behavioral that you display can be understood as being a direct consequence of the brain injury, or in fact warrants a diagnosis of a mental health condition. Sometimes brain injury can result in the development of a mental health condition. Research indicates that people who have experienced a brain injury are more likely to develop a mental health condition than the general population, particularly the conditions of schizophrenia, bipolar disorder, and clinical depression. The exact reason for this is unclear, although some suggested causes are damage to the brain itself, changes in neurotransmitters, chemicals in the brain, and the psychological trauma of brain injury. If you're diagnosed as having a mental health condition after the brain injury, this is called a dual diagnosis. A dual diagnosis can sometimes result in one condition having an impact on the other. For instance, someone diagnosed with clinical depression may not want to engage with rehabilitation following brain injury because they do not feel motivated to do so. Similarly, someone with schizophrenia may not trust his or her term of rehabilitation therapies if they have delusions of persecution, a fixed belief that people are intending to harm and persecute someone in the absence of evidence. In addition, a brain injury can exacerbate pre-existing mental health issues. For example, someone diagnosed with bipolar disorder before their brain injury finds um, finds that their fluctuation take place more rapidly after their brain injury. A brain injury can sometimes be apparent if an external injury has occurred, such as an open head, wound from a road, traffic accident, or if a scan show an abnormality such as tumor. However, often there are no obvious signs of a brain injury and it remains a hidden disability. Similarly, there are often no visible signs of mental health conditions and they are often also hidden. They can also be particularly difficult to distinguish from the already changed behavior that can be typical of brain injury. As mentioned earlier, changes in emotion, psychological states, behavior, and cognition are all very common issues following brain injury and do not necessarily indicate a mental health condition. So it is important to ensure that you are receiving support from services that are appropriate for you. Therefore, if you have not been diagnosed as having a mental health condition, you should not be referred to mental health services, but to services that are specifically for brain injury, as the effects of brain injury are often not visible, especially the hidden effects such as emotional changes. It may be difficult to explain to people, even medical professionals, that the effects are the result of a brain injury and not commonly known mental health issues. You can show this fact sheet to anyone if you feel that it helps to clarify the difference between mental health and brain injury and the importance of being treated appropriately. And that's all for this topic, and thank you.